11 things that spike blood sugar levels, making your diabetes spiral out of control. In this video, I'll list these points and explain how to address them. It's not enough to just know, we need to understand what to do about it if possible. Alright, let's start with number 1. Stress is a major factor in raising blood sugar levels. Why? When stressed, your body increases cortisol and adrenaline production. This triggers a metabolic response in your body. Blood sugar levels rise as a result. This stress response is the body's way of staying alert. Non-diabetics won't develop diabetes from this. Many claim diabetes is emotional. You don't get diabetes just from being stressed. But for those with diabetes who already have insulin issues, whether it's type 1 diabetes where you don't produce insulin, in type 2 diabetes, your body can't use insulin effectively, so insulin can't work to move blood sugar into muscles and tissues, leading to uncontrolled levels and increased hormones. Cortisol, for example, goes up. So how can you address this? First, identify the triggering situation. It's not always obvious, you know. I once had a patient who hated driving. Her levels spiked during her 2-hour commute in traffic. Work can be another trigger. One patient only got control after changing jobs. She worked in a call center and a new opportunity came up. Her blood sugar improved as the job was less stressful for her. Some relationships you'll need to distance yourself from. Try listening to relaxing music before bed. I personally enjoy listening to piano music. Identify the issue and see if you can address it. It won't always be easy to resolve. Take employment issues, for example. Often people have limited job options. You might need to wait for opportunities. Identify what you can do in your situation. Consider cases like separations, for instance. You can't always prevent these things. Divorces are periods you may have to endure. Stress can cause high blood sugar levels. So, number 1 is stress. Number 2, lack of routine raises blood sugar. Our body needs to understand sleep and wake times to regulate certain hormones. Cortisol is one hormone that regulates the circadian cycle, which I explained as the day's phases. Your body needs to know how to produce cortisol. We've seen that blood sugar levels rise when cortisol increases, so maintain a routine. Of course, you can occasionally deviate from this pattern. You don't need a fixed sleep time daily, but you should have a routine. Most days, you should have set bedtime and wake-up times. And get enough sleep too. Sleep is crucial. A study found night workers, or those with reverse schedules, had higher risks of type 2 diabetes. Because of this, the body can't regulate the circadian cycle well. This is crucial for controlling blood sugar levels. The higher cortisol production in the morning is natural. It's physiological. The body knows how to handle it. The problem starts when production becomes uncontrolled. Many people view cortisol as a villain, but it's not a villain. I'm talking a lot about cortisol. I want you to understand that cortisol is necessary for survival, for example. It helps maintain blood pressure levels. So cortisol is important, but excess cortisol, or when it's produced incorrectly or in high amounts, either due to something you did or rarely, a cortisol-producing tumor, just to mention it. This can lead to uncontrolled and significantly increased blood sugar levels. Speaking of cortisol-producing tumors, that alone can cause diabetes. It's a greatly increased and often continuous production. Let's move on to number 3. Number 3 is something everyone knows, but I'll mention it here because it's a reason why people struggle to control their diabetes, and I'll explain more about it. Simple carbohydrates, sugars. Here we're talking about refined sugar and anything your body quickly absorbs, spiking blood sugar levels. What's the controversy with sugar, simple carbs, and flour? It's similar to what I said about emotions. If you're not diabetic and have a good metabolism, if you don't have any issues with it, if you're physically active and hit the gym regularly, eating some sugar won't cause diabetes. But diabetics need to be careful and limit these carbs. I'm not advocating for zero carbs or keto diets. In fact, that diet can be risky for diabetics. You should limit and moderate your intake, okay? Because if your body already has altered sugar metabolism, eating more sugar and not avoiding naturally sugary foods, you'll have a much harder time controlling your blood sugar levels. That's why. You've probably seen videos of influencers or coaches, often not even doctors, claiming sugar isn't a problem and you can eat it. It's a topic that creates a sense of camaraderie and good feelings. So is it really okay to eat sugar? Hold on a second. If you're diabetic, you do need to be careful. Number 4, infections. Infections can significantly raise blood sugar levels. This could be a skin infection, flu, cold, tonsillitis, or sinusitis. Why? To fight infections, the body naturally increases blood sugar levels. It's a physiological response. Diabetics know this well. What happens when you catch the flu? In this case, it's crucial to note when it occurs for your doctor. Often, doctors see blood sugar levels way off and change the treatment. When the infection improves, levels drop, but you're on different meds. This can lead to hypoglycemia or very low blood sugar levels. It's important to note down this period. Not much you can do about it, right? Everyone gets the flu at some point. It's bound to happen. Blood sugar levels will fluctuate periodically. This applies to blood tests too. If you're sick or have the flu when testing, better postpone it. Do it another time. Infections can alter test results, like fasting blood glucose. This can even lead to a false diabetes diagnosis. It's happened before. I always ask, were you sick or had the flu that day? Often they say yes, so we retest. Usually the levels come down. It was the infection causing it. Got it? So, infections, share your thoughts and tell us which city or part of the world you're watching from. I always love to know. At the end, I'll give a shout out to everyone who mentioned their city. All right, let's continue. Number 5, which can raise blood sugar levels, is body fat. A major factor. Body fat hinders insulin action, as I explained earlier in this video. It's been linked to poorer control of blood sugar levels. It's really interesting how strong this connection is. For type 2 diabetes, fat tissue is probably the main risk factor. It seriously messes with how insulin works in the body. Not all diabetics are overweight though. Some are actually quite thin. This can be confusing for people, but it's a major cause and can make blood sugar levels worse, okay? So, body fat is a big deal. Number 6, medications. Many medications can raise blood sugar levels. Examples include anti-inflammatories like corticosteroids, dexamethasone, prednisone, hydrocortisone, many antidepressants, some blood pressure meds, certain diuretics that reabsorb glucose, some cholesterol drugs, and antibiotics. I'll add a note here so you don't worry too much about this. If the doctor prescribed it, they think it's worthwhile, like with corticosteroids. I'm not against corticosteroids. I've often prescribed corticosteroids, but only when benefits outweigh risks. We already know this. This effect is well known, okay? It's important to know some meds can alter blood sugar levels. Number 7, sedentary lifestyle. Why sedentary lifestyle? Do you not do physical activities? Many people say, oh, I don't exercise because exercise increases blood sugar levels. Is that true? Well, let's talk about it. When you exercise, like swimming or going to the gym, you improve body composition and increase muscle mass. This is very beneficial for people with diabetes. Whether it's type 1 or type 2 diabetes, muscles are our allies. They take glucose from the blood and use it as energy. So what now? Many say physical exercise increases blood sugar. That's also true, but let me explain. Calm down. This can happen with intense, short-term exercise. Why? Some activities can boost adrenaline production, but in the long run, it's very beneficial. So don't worry about temporary spikes. Long-term benefits are proven, okay? Now you know about this common myth. I hope this clarifies the question in all my videos. Number 8. First, are you enjoying this video? Is it helpful? Don't forget to like it. Let's aim for 11,000 likes. 1,000 likes for each tip I'm sharing here. Number 8, which can also cause blood sugar level spikes, is surgeries like stitches or any operation you've had, especially major surgery, as the body undergoes stress. During this time, hormone production increases. This can disrupt diabetes and blood glucose levels. Dental implants count too. That's why dentists often request a doctor's evaluation. It affects healing and can worsen post-surgery. So it's crucial to control blood sugar before surgery. Number 9, hormonal changes during menstruation, puberty, and pregnancy. These changes can influence certain hormones, like progesterone during puberty or pregnancy, where the placenta produces a hormone called placental lactogen, which also raises blood sugar levels. That's why pregnant women have a higher risk of gestational diabetes. You've probably heard of this before. So these changes are the reason for that. I once treated a type 1 diabetic patient who was well controlled, but suddenly his levels spiked without diet or routine changes because he was entering puberty. It's a sensitive time when blood sugar levels can fluctuate. Number 10. Everyone knows smoking's bad, including e-cigs and cigars. A large study found that smokers had higher insulin resistance and a much greater risk of type 2 diabetes. Not only that, but cardiovascular risk also increases significantly. Number 11, the most unfair factor is genetics, something we can't do much about. A study showed 75% of type 2 diabetics have a family member with diabetes. Why? It's due to the genes involved. You're not a prisoner of genetics. Controlling other risk factors helps, but genes are crucial. Remember when I mentioned obesity? Not all diabetics are obese. Some have strong genetic predisposition to insulin resistance. It's vital to control all modifiable factors I've mentioned in this case. Well, did you enjoy this video? On a scale of 0 to 10, how would you rate it? If it's a 10, I'll make more videos like this. Now here's a tip. Best and worst foods for diabetics. Did you catch what to do? What situations should you avoid that can spike blood sugar? Knowing about food is crucial for understanding diabetes. Click here for that video. Hope you'll like it. Take care. See you next time.